Let's talk about FDIA. Munchausen by proxy, now formally called factitious disorder imposed on another, or FDIA, is defined as willful and intentional behavior. The core feature of FDIA is deliberate deception. The caregiver consciously falsifies, exaggerates, or actively induces physical or psychological symptoms or illness in a person under their care, usually a child, but sometimes an elderly or disabled adult. Then they present the victim to others, especially medical professionals, as genuinely ill or impaired. Key points from medical definitions, DSM-5 and clinical sources. The actions involve intentional production or falsification of symptoms or injury. This includes making up stories about symptoms, tampering with tests, example, adding blood to urine or stool, actively causing harm, example, poisoning, suffocating, withholding food, or inducing seizures. The behavior is deceptive by design. The perpetrator knows the victim is not actually sick, or not as sick as presented, but proceeds anyway to mislead doctors and others. It is distinguished from other conditions like delusional disorders precisely because of the conscious intent to deceive, not a belief that the symptoms are real. This makes FDIA a recognized form of child abuse or dependent abuse, called medical child abuse, caregiver fabricated illness, or pediatric condition falsification in different professional contexts. The harm to the victim can be severe, including unnecessary medical procedures, medications, surgeries, or even life-threatening injury. About motivation and awareness. The behavior itself is willful. The caregiver chooses to do it and knows they are deceiving. However, the deeper psychological motivation, why they feel driven to do it, is often not fully conscious. Common internal gains include attention, sympathy, feeling important as a devoted caregiver, often a mother, or a sense of control or power over medical staff. It is not primarily for obvious external rewards like money. That would be malingering instead. Many perpetrators deny or minimize what they are doing, even when confronted with evidence, and they may lack full insight into their own reasons. The compulsion can feel addictive to them, similar to other compulsive behaviors. In short, the acts, falsifying or inducing illness, are intentional and conscious, while the underlying why may involve unconscious psychological needs. Important distinctions. Not the same as ordinary child abuse or neglect, although it overlaps and is still abuse. Not delusional. The person is not genuinely believing the fabricated illness is real in the way a psychotic disorder would involve. It can coexist with other issues. For example, the caregiver may have their own history of trauma, factitious disorder imposed on self, or personality problems. This is a serious safeguarding issue.